Thank you, Dr. Swaminathan. Helen Branswell from STAT. Helen.
Thank you very much for taking my question. I wanted to pick up on something that the Director General said in his opening remarks about the vaccine manufacturer, some of the vaccine manufacturers trying to sell boosters while many countries have had no access whatsoever to vaccine. Has the WHO seen any data from Pfizer or any of the other manufacturers that would suggest to WHO that there is a serious decline in efficacy at 6 months that would require a booster shot? And what would trigger the need for a booster shot? Would simply an increase in mild cases be enough, or would you need to see an increase in severe cases? Thank you.
Thank you, Helen. Maybe we can call on Anne Lindstrand, who is online, to address this question. Anne?
Yes, thank you for your question. The booster doses, we have not any systematic, and enough evidence that could point us to the need for booster doses. There is a decline, as it is with many different vaccines, but if you have, like we proposed in all of our policies on the vaccine-specific policies from SAGE, a full course of vaccination of any of the WHO-EUL vaccines, you do have a good protection. If you look at it on the global public health impact at this moment in time, we're confident that giving a full course and you have of the vaccines in place is at this point in time, it's then more important to be able to vaccinate a larger global population with the vaccines we have, rather than expanding to use the limited supply of doses we have in giving them to already vaccinated populations. It's very, very important now to think about rethink in those countries who have either started or think about using booster doses, that they do reconsider and think of it in a global perspective, and maybe hold off thinking about this policy change. SAGE, our strategic advisor group of experts, are definitely looking at any evidence coming through on the need and use for booster doses. But at this point in time, there is no data enough for us to point out the importance of booster doses. And particularly with the limited global supply, it is important to rethink if any country is pondering about increasing and using booster doses, and instead think of giving that supply or sharing that supply to countries that have not even reached their healthcare workers. Over.
Just to add to what Anne said, really want to caution folks, because there is a tendency now for people in countries with enough availability of vaccines to, voluntarily start thinking about an additional dose. There are people who are thinking about mixing and matching. We receive a lot of queries from people who say they've taken one and they're planning to take another one. So it's a little bit of a dangerous trend here, where people are we're in a data-free, evidence-free zone as far as a mix and match. There is limited data on mix and match. There are studies going on. We need to wait for that, and maybe it will be a very good approach. But at the moment, we only have data on the AZ vaccine, Oxford, AstraZeneca, followed by Pfizer. So it will be a chaotic situation in countries if citizens start, deciding when and who they should be taking a second or a third or a fourth dose. The other thing, just to add again, is if we are tracking the policies in countries, we have 4 countries that have announced a booster program and a few more that are thinking about it. If 11 high and upper middle income countries decide, some of them are large countries, that they will go for a booster for their populations or even subgroups, this will require an additional 800 million doses of vaccine. And we were just, the DG was talking about why we need to prioritize doses through COVAX to go to countries where the frontline and healthcare workers have not been vaccinated, and the elderly and the vulnerable. So at this point, when there is no scientific evidence to suggest that boosters are definitely needed, we have seen in some countries an increase in infections, but no significant increase in hospitalization or deaths. And it may well be that you need boosters after a year or 2 years, but at this point, after 6 months of the primary dose, there doesn't seem to be any indication. And we'll continue to work with public health agencies around the world who are tracking this data. SAGE is following the evidence very carefully, and we will make recommendations on boosters when we think that they are needed. It has to be based on the science and the data, not on individual companies declaring that their vaccines should now be administered as a booster dose. Thanks.
And just to add, I think I said at a previous press conference about this been about some people wanting to have their cake and eat it. Well, this goes a bit further. This is people who want to have their cake and eat it, then they make some more cake and they want to eat that as well. I think the DG is clear. He's not saying that companies should hold off on making a decision whether they do booster doses or go for all out for vaccinating the most vulnerable. The data is clear. The people who are most vulnerable are dying. The health workers in the front line are unprotected. He is very clearly calling for an all-out, no-regrets push to get all of our frontline workers in the world and get all of the most vulnerable and our older populations vaccinated so we can take the awful tragedy out of this pandemic, which is overrun health facilities and people fighting over oxygen bottles and all of the things we see on our TVs every day, the funeral pyres and everything else. And that is possible right now. And he's clearly asking for everyone to take a step back and now recommit themselves to an objective of protecting the most vulnerable, protecting those most likely to die, protecting our frontline health workers. That is not to say that boosters will not come into it later on. It is not to say that it's good to discuss that science and do that research. Of course it is. But we need to decide what our priority is and what part of this is a global crisis are we not getting. This is still a global crisis. And it is a time to protect those who are most vulnerable in our society. And if we don't do that, and if we move on to other matters, then I think we will be judged. A journalist asked before about the mass gathering events. We will look back in anger. And I think we will look back in anger and we will look back in shame if we don't now move to use the increasing production capacity that's coming online, transferring that technology for even more capacity, using that to protect the most vulnerable, protect our frontline health workers everywhere in the world, take the death and the hospitalizations and the ventilators out of this pandemic, so we can then have more choices for broader coverage, for broader disease control, and for boosters and everything else that comes with it. It's not to say one or the other. It's putting things in a crisis in order. We all do this. In a crisis, you do things in the order that is most beneficial, most life-saving. That's what an emergency is. You can't do everything at one time. You must make choices. And the choice we need to make right now is to go all out with no regrets for a policy that will cover the most vulnerable. That is all the Director General is asking for.
Thank you, Dr. Ryan. Next question comes from Alejandro.